About 6 months prior to the pandemic, we really sat down and started getting serious about needing to meet the consumer where they are, meet our team members where they are. The majority of people have a smartphone. How do we leverage the technology that's already available, but apply it to the extremely complicated industry that is healthcare?
That was Taylor Hamilton, Senior Vice President and Chief Consumer Officer at Ballad Health, explaining how her team has approached the complicated process of digital transformation. In this episode, Taylor shares about her passion for using technology to improve the patient journey. She also discusses the process of implementing Salesforce and explains how Versus 12 helped Ballard become more agile in the midst of the pandemic.
Transformation is a journey. I truly don't believe it's ever perfect and it's never complete. Every day when I sit down, I think, okay, what could we do to make the patient journey better?
You're listening to How I Transformed This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode we're seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, be sure to visit versus12.com/podcast. Now, let's jump in.
Hello, my name is Taylor Hamilton. I am the Senior Vice President and Chief Consumer Officer at Ballad Health, and I have been in healthcare since I graduated for 17 years. That makes it sound like a really long time when I say it like that.
Well, Taylor, I've been in healthcare longer than that, and so I'm not going to even say how long because that would allow people to start counting and doing math. But I want to tell you how thankful I am that you were on our podcast. I have wanted to tell the story of Ballad Health and specifically you and your leadership at Ballad Health. You don't just talk about patient engagement, you're really living it. And that just thrills my heart because that's what it's all about in the transformation of healthcare. So welcome aboard. We're so excited to talk to you today.
Yes, welcome. Thank you so much for taking time out of your day to share with us what you're seeing right now with driving transformation in healthcare. And we've got some special things planned because, Tammy, I believe we've got an announcement here on this podcast. This is a special award, actually, that I understand you're going to be not only telling Taylor about, but also kind of the why behind it.
Yes, absolutely. So by the time this podcast airs, we will have already had our Customer Success Awards ceremony. And Ballad Health specifically is winning the Versus 12 2021 Customer Success Award in the category of collaboration. So what we do every year is we honor our clients who exhibit the same core values as we do: collaboration, passion, transformation, and integrity. And specifically for Ballad, what we had to go through to actually implement the Salesforce system at Ballad, which Taylor's going to tell us about, required just tremendous collaboration between the two teams. And it's just a really great success story. I mean, I believe that we started this project with you, Taylor, about 2 weeks before COVID hit. Is that right?
Yeah, just about 2 weeks before. And then there was a long runway prior to even getting to project kickoff.
Yes, absolutely. And, it was a scary time for all of us, but I'm sure especially for you guys at the health system with all the challenges you had to face. So tell us a little bit about what it was like during that time, trying to really just keep up with all the operational demands and implement a new transformational technology.
Yeah, wow. Well, there's a lot to unpack there. How long is this podcast? I think it's really important to start at who Ballad Health is. And
yes,
I won't be extremely long-winded about that, but Ballad Health is only 4 years old. We're the product of an in-market merger of two of the largest competing health systems in our region. Our region is about the size of New Hampshire. We serve about 1.2 million people, 29 counties. We pull from 4 states, and we're extremely rural. We're in Northeast Tennessee and Southwest Virginia. We already have this wonderful opportunity to serve our region. As with any merger comes a lot. You've got rebranding. We had to get everyone on the same network. We did a massive Epic Big Bang. Part of the organization was on Epic. Then, of course, we merged. We brought everyone else up on Epic. We replaced 14,000 computers. We did a really big update to Microsoft Windows. So, I mean, it's like the and then this little thing called COVID-19 started to blip on everybody's radar. And, then that, of course, is what we're still battling today, right? It's definitely not gone. We certainly are making a lot of headway, not just in our organization. I think in general, we're doing a lot to help combat COVID, to get people well and make sure they're safe and they're protected. But amongst all of the things that come with the merger, we also were juggling and helping manage our community through this, hopefully once in a lifetime pandemic. So there was a lot of thought that went into selecting Salesforce and then, of course, Versus 12. We wanted to make sure, as part of our digital transformation, creating the foundation, laying that foundation is so important. We didn't want to rush our decision. I actually think from a timing perspective, there's never a good time for a pandemic, but we had already made the decision. We'd already done a due diligence for about a year on finding the right partners to host our CRM, to help leverage our data, to help make these decisions that we're making when it comes to patient care on the consumer side. I was really pleased that we did that. And while there was a delay, we knew what we wanted. So we had this great relationship with Salesforce. We got that off the ground. We developed this great relationship with Versus 12. So when the pandemic did strike, it was, okay, let's step back just for a little bit, and then we can charge ahead. And with this new information, being able to be agile, which was extremely important, we were able to really create something that laid that foundation that we were looking for.
So, Taylor, there are lots of organizations out there that are talking about digital 360 and patient engagement and what they want to do. And it's not just the technology, it's a huge project in change management. And it takes collaboration, which is why, you guys have been tagged with the customer that really nailed collaboration during this pandemic. But it also takes change management and just pure willpower. So tell us about that. And then I would love to hear from your perspective. I mean, I know the use cases that were implemented as part of the system, but I'd love for you to share with our listeners all the things you guys are doing to really show the patients of the East Tennessee region that you guys are the health system to care for their needs.
Mm-hmm. So you're right. I mean, one of the largest reasons why we wanted this merger, the way we wanted the merger, was we wanted to keep healthcare local. We wanted our corporate headquarters to remain local, maintain the local jobs, and also serve the community that both of these organizations have served for years and years and years and years and years. With digital, which seems like, it is like the buzzword right now in healthcare, but with digital transformation, about 6 months prior to the pandemic, we really sat down and started getting serious about needing to meet the consumer where they are, meet our team members where they are. The majority of people have a smartphone. How do we leverage the technology that's already available, but apply it to the extremely complicated industry that is healthcare? Because as we all know, healthcare is not as easy as I'm just going to go on an app and make a reservation for a 4-top for dinner tonight. That's easy. Making an appointment, scheduling an appointment online on your mobile device is not, you want it to be that easy, the consumer experience, but the work behind it to make that a reality is complicated because, well, why are you coming into the doctor? Is it an emergency? Is it non-emergent? What is the visit type? Is it just a follow-up, or is it, do you have a sore throat? Do you have a runny nose? Did you break a bone? I mean, you have to think through all these different things. So I understand why there's been such a lag with technology adoption when it comes to digital transformation in healthcare, because it is extremely complicated. So what we did when we sat down as an organization and said, okay, how are we going to tackle this? We really wanted to map out what are all the different touch points for our consumers, because each consumer journey is different. We really broke it down into digital and physical touch points, because my belief is no matter how advanced we get in healthcare, this is still a high touch industry. There's going to be a point where more and more things are automated. There's more efficiencies, all the things we're all driving towards. But we're still in the industry of taking care of people. And I believe that, again, these are my personal thoughts. I don't ever think you're going to replace that with technology. At some point, that patient will need to be touched or a one-on-one in-person conversation. So it's really important for us to map out what are all the digital and physical touch points along the continuum. It could be they're in a car, they see a billboard, or they get a text message, or how was their service interaction? Was it easy for them to make an appointment? Was the waiting room clean if they decided to come into an urgent care center? And then all along the way, each one of our touch points, we also consider a data point. And data is, as you know, and the 360 patient is so important. So first step was, how do we collect this data to personalize the journey for each patient? And how do we get real life conversations in the patient's rooms? What I mean by that is, I have this vision that eventually we're going to get to a point where your clinician comes into your room. Let's say you're an inpatient. Let's say you're in having a baby. You're in labor and delivery, and you're sitting there, and the doctor comes in or the nurse comes in, and they've got an iPad. And in the iPad, they pull up Taylor Hamilton, and they see, half the screen is all of my medical records. We're using Epic. So it's everything in Epic about Taylor. It's all my medical history, my weight, and all of the things, how many babies I've had, all of the things. But on the other side of the screen is the human. How do you humanize this conversation? It's Taylor on the other side. Taylor is a mom of 2. She has 2 dogs. She's been a patient with the organization for this long. Through various conversations, we're gathering the human side of the journey. And she's been here for this long. She lost her mother a few years ago, and then maybe that came up in a conversation. So, I think that you have that relationship if you've had your physician for 5, 10, 15 years. Unfortunately, the way we're all heading is we're a lot more transient. Most people don't live in the same place they grew up in. So in healthcare, how do I walk into a physician's office, and maybe I've been there once or twice, but they know me? How does the organization show me that they know me? And it's all data driven. And of course, it's information that I've willingly shared, but the organization has gotten so sophisticated and they care enough to pull all this together that they know my story because I trust them with my care.
I love this. All right, so there are so many things here I am loving. One of them is that question of how do we use technology that's available right now to bring solutions to what you're clearly describing as a very complicated system. I think also what you're describing, with no matter how technologically advanced and automated things are, you still, of course, you have to have that human touch. And so I would love to hear, how you can find the best of both worlds. You mentioned Salesforce a moment ago, and how do you find that balance of improving efficiency, but also preserving that human touch?
Yeah, what I know about what Ballad implemented was, I think, a beautiful blend of when the patient calls in, they have a question of the health system, that there's enough information they know about that patient based on the caller ID, that they can not only guide them and help answer the question, but also potentially schedule them in a preventative healthcare educational series and things like that. Taylor, I'd love for you to kind of share that the specific things that you guys did to make those patients feel that you knew them in a real way.
So we've got right now we have 2 call centers, and we thought it was really important, and this was a journey we started prior to the pandemic, to have a consumer-centered call center. So prior to launching the consumer, we call it the consumer call center. Prior to launching that, we had one call center that is phenomenal. The director of that call center actually helped lead the charge in adopting and selecting the Salesforce CRM. We worked really closely with her on the implementation with Versus 12 to make sure we were building out the platform exactly the way we needed it as an organization to customize it. So it made sense to us, but also captured the information that we had. But as we went through this exercise, we realized quickly that to be really consumer centric and focused like we wanted to be, we had to launch a new call center. We had to create a new department. And the executive leadership, the leadership in our board of directors were extremely supportive of this and rallied around the idea to launch something of this nature. So in parallel to building out the information platform with Versus 12, we also started our plan on launching a consumer-centered call center where we have agents that live in this region. Most of them were born here. And everyone that works in the consumer call center right now has been with the organization for over 10 years each. So they know everything. And customer service is so important. I'm sure we all can think of 5 brands off the top of our heads that we interact with because they know us, it's easy, they're friendly on the phone. We getting back to the complexities of healthcare. Healthcare systems are so complex and some are fragmented still. So we thought of, okay, if we could pull all this together into one location with our data, we need to pull it all together eventually into a one phone number. And our vision is to get one phone number. And as a patient, you call this one number and you're going to get somebody on the phone that lives here, that knows the system. They know that the orthopedic appointment that you're going to is located on the corner of this street and this street where the old oak tree used to be. That's an actual reference I heard the other day when I was walking through the call center. And I'm not as familiar with that. I've been here for 7 years. So I feel like I've been here a long time. It's the longest I've lived in one location. But the community is so tightly knit. I've never seen anything like it. It's so beautiful. And they truly care about one another. And everyone knows each other. So when you have a patient might have an unpleasant experience, they call the call center. And through conversation, they find out that this is so-and-so's cousin that's lived here for a long time. All of a sudden, the situation has been diffused. We get to the core of whatever they're calling for. We find the solution and, we help them. Ultimately, that's what we want to do. We want to leverage technology to provide these personalized solutions for our patients. And it's one of the main reasons I got into healthcare. I knew at a very young age, I wanted to help people. The majority of my family they're physicians and they're nurses. And I didn't necessarily know if that's the path I wanted to take, but through interning and volunteering and just schooling, realized very quickly there's various levels of healthcare that are non-clinical that need support, and you can still effectively help someone. So I think there's a lot that we're doing to leverage the technologies that are currently available to help meet the consumer or the patient where they are, to create the bond needed to keep them engaged, to keep them happy, and to keep them healthy.
I love that, Taylor, and I could not agree with you more. And, we're a technology company, but we feel that the technology is there to assist the process of healthcare and caring for the patient. And my mother's getting older. I helped her just a couple of weeks ago schedule a colonoscopy appointment, talk to the doctor. There was some things that she had, medication she was taking, she had questions about. And the process was to just drive us online and not talk to a human being. And even for me as a technologist, that was a pretty frustrating process because there's just some things you need to talk to a human being about it.
Right.
And I think that what you guys are doing at Ballad, not only in providing the call center, but also going deeper and really trying to know as much as you can about that caller and the community is phenomenal. And that's what healthcare is all about.
Yeah. And it's a journey. Transformation is a journey. I truly don't believe it's ever perfect and it's never complete. Every day when I sit down, I think, okay, what could we do to make the patient journey better or the interaction better? And we have all of these wonderful tools that we are starting to implement and to roll out to help our team members interact differently with our patients and help our patients have this better experience. But we'll never be done. It's never, ever going to be complete. And that's what makes it exciting because we can only get better.
Whoa, I love this. So I have a follow-up question to that. And this kind of connects to this award that you're being recognized with. So transformation is a journey. And when you're thinking about making that patient journey better, as we're starting to wrap up, what are some of your big takeaways that you really want to leave with us as it relates to maybe change management or patient engagement? Are there any things that you've especially learned these last 18 plus months with what we've been going through this whole world?
Collaboration, and I know we started with that. Versus 12 is recognizing Ballad Health for collaboration this year. And I would say it's collaboration with the entire system, but also our patients. We've done a lot of listening. We listen to our team members on how we can change things to make it easier for them to take care of our patients. And we also listen to our patients. What do they want? How do they want to be listened to? How do they want to be treated? How do you want to interact with your health system and your providers? And what we're finding is there's not one silver bullet. We have people that want to come in person no matter what. We have people that want a virtual visit. We have people that want to schedule virtually online. We have had, and this is not an exaggeration, we have had patients fill out direct mail cards where we've looked for someone to sign up for a program, filled them out by hand, and driven them to the marketing department to drop them off because they wanted to make sure that they got there.
Wow.
You never hear that.
Right. So really, this omni-channel approach and the 360-degree patient really go hand in hand, because what we're doing with transformation is we're changing, but we're not replacing. We're just adding more lanes for people to interact with us. So what's your comfort level? Is it a text message? Is it a phone call? Is it an email? Do you want to walk in and talk to somebody face to face? We need to get to where we can really deliver on our vision and our mission in as many ways as possible based on what that person is looking for.
Well, Taylor, it was very obvious to Versus 12 when Ballad was selected as the 2021 award winner for customer success and in the collaboration area. Now it is obvious to all of our listeners that that's what is making Ballad successful. Just the way that you are going about serving the community and implementing these technologies to help make it better and easier to access care in the region. So thank you for that.
Well, thank you. I think it's really important as part of collaboration and what I mentioned is that this is not a one person job. It is not a one department job. It is a cultural transformation of the entire organization working together to come up with solutions and to implement them. If it wasn't for having the relationships and partnerships like we do with Versus 12, this wouldn't be successful. I can say, because we've been working so hard to get new things implemented, if we didn't have the relationships that we did with our partners, and we did not have the willingness of the organization and each individual within it to learn new things and to want to get better and to want to really serve our patients, with all that, we wouldn't be successful either.
Yeah, well, thank you for that, Taylor. See, you guys are just proving it can be done. You're setting the pace for everybody else.
That's great. Thank you again for taking the time to join us, and congratulations on your award.
Thank you. Yeah, we're honored to receive that and look forward to what's to come.
Thanks for listening to How I Transformed This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.